Okay, so we will continue the exploration of, or rather learning of nerves of the lower limb, right? So this is the last nerve in the lower limb, the last branch of the sciatic nerve. Okay, larger branch of the sciatic nerve is tibial nerve, whereas the common fibular component is smaller than the larger tibial part, right? So today we'll learn about common fibula. In the common fibular component, common peroneal nerve is approximately half the size of the tibial nerve. Okay, so and is derived from the dorsal branches of the fourth to fifth lumbar, L4, L5, and first and second sacral ventral rami, S1, S2. Okay, this is dorsal, this is ventral. It descends obliquely along the lateral side of the popliteal fossa, right, to the fibular head, medial to the biceps femoris. So, as the sciatic nerve divides into tibial nerve and common peroneal parts in the lower one third of the, because the size is variable, most of the time it is in the lower one third of the thigh, right? So, along the lateral side of the popliteal fossa to the fibular head, medial to the biceps femoris. So, let us see how it is, right? So, this one is tibial now, this one is common peroneal, right? So, this is the biceps femoris long head. So, this is medial to the long head. So, okay, I'll show you something. So, this is sciatic nerve dividing, right? In this atlas, there is sciatic nerve dividing into continues as a tibial nerve and common peroneal parts, right? So this is the head of the biceps femoris, long head. So the common peroneal nerve lies medial to the head of the biceps femoris, right? And it lies between the tendon of biceps femoris, to which it is bound by fascia. Remember that it is bound by fascia to the tendon of biceps femoris and lateral to the lateral head of gastrocnemius. So you see, this is the gastrocnemius, this is the lateral head, this is the middle head. Okay, lateral head of gastrocnemius and medial to the this one, biceps femoris, right? The nerve then passes into the anterolateral compartment of the leg through a tight opening in the thick fascia overlying the tibialis anterior. It curves lateral to the fibular neck, deep to the fibularis longus, and divides into superficial and deep fibular nerves. So we'll see its course. Okay, so this is where it, okay. So you see, this is the common peroneal nerve, right? This muscle is fibularis longus or peroneus longus, right? This one is peroneus longus, whereas this one is a tibialis anterior. So if you remove peroneus longus, you will have the division, right? This is the fibula, this is the head of the fibula. So where the head of the fibula, right, is dividing into superficial and deep peroneal nerves, right? This is the overlying peroneus longus. So this tunnel is called as peroneal tunnel, right? Where it is coursing behind fibularis longus. We'll see that in a minute. In an articular trunk derived from the deep fibula now. I'm sorry, somebody is writing. Okay, articular tongue derived from the deep fibula now provides an articular branch that travels with the anterior tibial recurrent artery and a proximal branch to the tibialis anterior. So you see, this is the common fibular now. Okay, this is biceps femoris. You see, common fibula now curving around the head of the fibula and taking its course, right? Dividing as superficial branch and deep branch, right? This is the deep one. Deep fibular nerve, which accompanies the anterior tibial artery throughout its course, right? So you see, this is how this is the nerve. This is where the fibularis longus arises, right? So this is how it divides. This is deep. This is superficial nerve, right? Again, the same deep nerve and superficial branch, right? So you see, fibularis longus muscle. This is the dissectional part. You see, 2 is common fibular nerve, right? Number 2, whereas this one number 16 is deep fibular nerve and 26 is superficial fibular nerve, right? So from here it is taking course as like this, and from here it is taking course like this and coursing, right? Branches, articular branches, cutaneous branches, and superficial and deep nerves. There are 3 articular branches. 2 accompany the superior and inferior lateral genicular arteries. They may arise in common. The third recurrent articular branch arises near the termination of the common fibular nerve. It ascends with anterior recurrent tibial artery because the recurrent artery arises, like if you remember the genicular anastomosis, through tibialis anterior and supplies the anterolateral part of the knee joint capsule and the proximal tibiofibular joint, right? Coming to the cutaneous branches, the 2 cutaneous branches often form a trunk are the lateral soral and soral communicating nerves. Remember that lateral soral and soral communicating nerves, and we have a soral nerve from tibial nerve, right? Soral nerve is a branch of tibial nerve, whereas the lateral soral nerve and soral communicating nerves are branches of cutaneous branches of common fibular nerve. The lateral soral communicating nerve, cutaneous nerve, also called as lateral cutaneous nerve of the calf, supplies the skin and anterior, posterior, and lateral surfaces of the proximal leg. The soral communicating nerve arises near the head of the fibula, crosses lateral head of the gastrocnemius to join the soral nerve. So that is why it is called a soral communicating nerve. Means it communicates with the soral nerve. It may descend separately as far as the heel. You see, this is the lateral soral nerve. Okay, this one which is communicating with the soral nerve. Okay, this is the soral nerve, is soral communicating nerve, right? You can see that. So you see, that is the lateral soral cutaneous nerve supplying the anterior part, lateral part, and you see the whole of the proximal leg, right? So this one is lateral Oral cutaneous nerve. Oral communicating nerve is not represented in this atlas. Right? We go through all those diagrams. Coming to the clinical anatomy, the common fibular nerve is relatively unprotected, right? That is clear as it traverses the lateral aspect of the neck of the fibula and is easily compressed at this site by maybe plaster casts or ganglia. The nerve may also become entrapped by facial band beneath the fibularis longus because it is crossing that so-called fibular tunnel between the attachments of fibularis longus to the head of the shaft of the fibula. So you see, this is the this one is the fibularis longus, right? So it is, so you see the nerve is crossing like this, right? This is the zoom picture of this only, right? So here it is has more chances to entrapment, common fibular nerve entrapment. Traction lesions can accompany dislocations of the lateral compartment of the knee and are most likely to occur if the distal attachment of biceps femoris and the ligaments that insert on the fibular head are avulsed, possibly with a smaller part of fibular head. So whenever this traction injury occurs, then the nerve will be affected. The nerve is tethered to the tendon of biceps femoris because its fascial attachment with the biceps femoris by dense fascia and so is pulled proximally. Severe traction lesions may produce longitudinal injuries affecting a long segment of the common fibular nerve. Sometimes the torsional injuries following ankle injury, okay, sprain of ankle or fracture of ankle may result in common fibular neuropathy because the injury is transmitted from the ankle along the interosseous membrane to the proximal leg. So this injury is transmitted from the lower end of the fibula to the upper end of the fibula through the interosseous membrane, right? That is how this nerve will be affected. Patient with such injury present with a foot drop. Physical examination reveals weakness or paralysis of ankle dorsiflexion. So inability to dorsiflex the ankle, toe extension and eversion, right, of the foot, but the inversion and plantar flexion are normal. Sensation on the dorsum of the foot, including the first dorsal web space, is diminished. The ankle reflex is preserved. So that is the common fibular neuropathy symptoms. Since the common fibular nerves divides at fibular neck into superficial and deep fibular nerves, injuries to the nerve at this level may damage either the main trunk or its branches. Electrodiagnostic studies can help localize a common fibular nerve injury to the fibular neck region. Okay. At this level, nerve conduction studies may show slow. So nerve conduction studies and event. Slowed velocities and electromyography would demonstrate denervation in the muscles innervated by the common fibular nerve, such as tibialis anterior, fibularis longus, whereas the more proximally innervated muscles, especially biceps femoris, would be normal. So whenever we conduct the velocities of nerve conduction, okay, it will tell us about when the nerve is affected, where the nerve is affected, level of injury. Coming to the its main branches, superficial and deep fibular nerve. Superficial fibular nerve begins at the bifurcation of the common fibular nerve. It lies deep to the fibularis longus at first, then passes antero-inferiorly between fibularis longus and brevis and extensor digitorum longus, pierces the deep fascia in the distal third of the leg. Right? We'll see. So this is where that is the common peroneal nerve, right? So this is the fibularis longus. Let's hide. So this one is superficial fibular nerve, okay, throughout its course. That is the superficial fibular nerve for you. right? We have already had the peroneus longus, right? This one is peroneus brevis, and this one is extensor digitorum longus, right? This is extensor digitorum longus, and this one is tibialis anterior. Extensor digitorum longus, this is peroneus brevis, and this is peroneus longus. So this is the superficial fibular nerve. It divides into large medial dorsal cutaneous nerve and smaller, more laterally placed intermediate dorsal cutaneous nerve. So medial dorsal cutaneous nerve and intermediate dorsal cutaneous nerve usually after piercing the deep fascia, but sometimes while it is still deep to the fascia. As the nerve lies between the muscle, it supplies fibularis longus, fibularis brevis, and the skin of the lower leg. The deep course, that is compartmental localization, and the peripheral digital distribution of the superficial fibular nerve are subject to considerable variation. The medial dorsal cutaneous nerve passes in front of the, okay, let's see. So you see, this is the, okay, I will divide this. Okay, this is the superficial fibular. Okay, that is the superficial fibular, whereas this one is deep fibular. Okay, we are concerned about the superficial only at now. This is the intermediate cutaneous dorsal branch. Okay, whereas this one is the medial dorsal cutaneous nerve. Why it is intermediate and why it is medial is because there is this nerve is sural nerve. Okay, right? So this one is lateral sural cutaneous nerve. Right, lateral dorsal cutaneous nerve. It is called as lateral dorsal cutaneous nerve, whereas this one is intermediate cutaneous nerve, and whereas this one is medial cutaneous nerve. You see, so these supplies the digits, right? Intermediate cutaneous and medial cutaneous. We will see how they. The medial dorsal cutaneous nerve passes in front of the ankle joint and divides into two dorsal digital branches, right? So this is the medial one, selected one, right? It is going to the medial side, so it is divides as the two these things. Okay, two dorsal digital branches. One uh, one supplies the hallux. Okay, medial side of the hallux or great toe. One of these supplies the medial side of the hallux, and the other supplies the adjacent side of the second and third toes. You see, okay, adjacent sides of second and third toes, right? So you see that, right? After third toe only. It communicates with the sapphus and deep fibular nerves. So that is regarding medial dorsal cutaneous. The smaller intermediate branch crosses the dorsum of the foot laterally, divides into dorsal digital branches that supply the contiguous sides of the third to fifth toes and the skin of the lateral aspect of the ankle where it connects with the sural nerve. Okay. So this one is the intermediate cutaneous. Now, okay, it also supplies the contiguous sides of the third, right, fourth and fifth toes. Okay, the lateral aspect of the fifth toe is supplied by the sural nerve. Both branches, especially intermediate, are at risk during placement of portal skin incision for arthroscopy and during surgical approach to the lateral malleolus. Okay, remember that branches of superficial fibular nerve supply the skin of the dorsum of all toes. Okay, except the lateral side of the fifth toe, it is supplied by the sural nerve, and the adjoining sides of the great toe and second toes. Okay, adjoining sides of the great and second toes supplied by the medial terminal branch of deep fibular nerve. We'll see that. Some of the lateral branches of the superficial fibular nerve are frequently absent and are replaced by sural nerve branch. You see, this is the so this one is the superficial fibular nerve, divides into intermediate cutaneous and medial cutaneous nerves. right? Intermediate cutaneous nerves divides into digital branches, right? Whereas the medial cutaneous nerves also divides into, it supplies the hallux and again supplying the, okay, you see this is the cadaveric specimen, right? So this is the superficial fibular now, right? So it is dividing as like this, right? It is supplying. So 13th is medial cutaneous, right? Whereas 6th is intermediate cutaneous nerves, okay? So you see these are the digital branches, right? Again the same thing, right? This one coming like this, okay? So this is, and this one. Again the same cadaveric specimens, excuse me, right? So this one is medial cutaneous, I'm sorry, intermediate cutaneous. This one is medial cutaneous. Same ones. So you see medial branch, lateral branch, or medial cutaneous, intermediate cutaneous, right? So this space is supplied by deep peroneal. Okay, so that space is accepting first web space, right? First web space is innervated by deep fibular now, whereas remaining, you see intermediate dorsal cutaneous now, and medial cutaneous now, right? So whole of this is superficial fibular now, and this one on the yellowish part is deep fibular now. An accessory fibular, superficial fibular nerve and an accessory deep fibular nerve have been described as variant branches of superficial fibular nerve. Both are probably the product typical branching of the parent nerve deep to the deep fascia. Lesions. A lesion of superficial fibular nerve causes weakness of foot, eversion, and sensory loss on the lateral aspect of the leg. Right? The nerve can be subject to entrapment as it penetrates the deep fascia of the leg, and it may also be involved in compartment syndrome that affects lateral compartments of the leg. So wherever the nerve supplies, they will be affected. Coming to the deep one, begins at the bifurcation of the common fibula nerve between fibula and proximal part of fibularis longus. It passes obliquely forwards deep to the extensor digitorum longus to the front of interosseous membrane and reaches the anterior tibial artery in the proximal third of the leg. So you see, so this is where it occurs, right? This is fibularis longus. Let's hide it. Okay. This one selected blue one is deep fibular nerve, right? So it is going in, that is extensor digitorum longus. This is tibialis anterior, right? So let's hide it. So this is how it is coming. So this one is superficial fibular nerve, this one is deep fibular nerve, right? If we add arteries, this is how, so you see, this is how it is accompanying the anterior tibial artery, right? So this is how it is accompanying anterior tibial artery, right? So let's remove arteries. Yes, that is extensor digitorum longus. Okay, behind that is the fibula, deep fibula nerve. It descends with the artery to the ankle where it divides into lateral and medial terminal branches. As it descends, the nerve is first lateral to the artery, then anterior, and finally lateral again at the ankle. Okay, this is how this is anterior tibial artery. We have already seen this. Okay, so the nerve supplies muscular branches, extensor hallucis longus, extensor digitorum longus, fibularis tertius, and an articular branch to the ankle joint. Right. So you see, this is extensor hallucis longus, extensor digitorum longus, and fibularis tertius. So these are the branches. It's supplying the muscular branches, right? Deep fibular. The lateral terminal branches crosses the ankle deep to the extensor digitorum brevis, enlarges as a pseudoganglion, and supplies the extensor digitorum brevis. Okay, remember that lateral one. From the enlargement, three minute interosseous branches supply the torsal and metatarsophalangeal joints. Of the middle, three minute interosseous branches supply the torsal and metatarsophalangeal joints of the middle three toes. That means, you see, so this is the lateral and this one is the medial. Lateral one forms as a pseudoganglion. That means ganglion means cluster of nerve cell nerve cell bodies, right? So this is how it supplies extensor digitorum brevis. Okay, this is the muscle of the foot. We'll see. So you see, that's extensor hallucis longus. We're going to hide it. So this is the deep peroneal now, coursing as lateral. See, lateral branch, and this one is the medial branch. See, lateral branches supplies the extensor digitorum brevis, right? This is the extensor digitorum brevis, right? And this one is the medial branch coming and supplying. You see, digital. You see the first web space, right? Medial terminal branch runs distally on the dorsum of the foot, lateral to the dorsalis pedis artery, connects with the medial branch of superficial fibular nerve, right? In the first interosseous space. Divides into two dorsal digital nerves which supply adjacent sides of the great toe and second toes, right? So that is first web space. Before dividing, it gives off an interosseous branch which supplies the first metatarsophalangeal joint. Defibular nerve and has three terminal branches, right? So that is how it terminates. You see, one is going to the lateral branch of defibular nerve joints to the extensor digitorum brevis, and another one is, you see, medial branch of defibular nerve joint to joints and first and second digits. You see, this is the first web space, right? You see, fibular nerve, and again it is coming like this and supplying this, right? See, so you see, this is the 16th. Okay, first web space, right? So this is the medial one. So remember all these things. Coming to the Clinical anatomy. Isolated injury to defibrillator nerve may result from compartment syndrome that affects anterior compartment of the leg or from intraneural ganglion cyst, right? Ischemic cyst within the nerve derived from the superior tibiofibular joint via the articular branch that reveals with the anterior tibial recurrent artery. So, by anything compartment syndrome or from cyst. Individuals with lesions of the defibrillator nerve have weakness of ankle dorsiflexion and extension of all toes, but normal foot eversion, right? Whereas the common fibular nerve lesion may cause unable to evert the foot, right? Along with ankle dorsiflexion and extension of toes. Sensory impairment is conformed to the first interdigital web space, right? So these are the direct branch to direct biceps femoris. Superficially is fibularis brevis and longus. Deep is tibialis anterior, extensor digitorum, brevis and longus, extensor hallucis brevis and longus, fibularis tertius, right? So that is the thing, right? That is okay. That is the isolated nerve. That means common fibular nerve, right? Along with it. God, what happened? Okay. Something is okay. Hope you understand the common fibular nerves well. If you have any doubts, let me know. Right?